What's up, everybody? Welcome back to my channel. It's been a while since I've been on. But today I actually just want to talk about something that's happening currently in the world, and this is COVID-19. And I just want to get your insights on how it is for you at your jobs working as a therapist. So I'll just kind of give you a little bit of insight into my world, and I would love for you to share, comment, leave your comments down below on how things are for you. So I can't name my facility, but I do work in skilled nursing facility in New Jersey, and we do have positive COVID patients there. Um, we started, in my opinion, a little late with our procedures. However, whenever you come into work, they take your temperature, you fill out paperwork saying that you're not sick, you haven't been around anyone that has it, you haven't traveled in areas or take flight in places from China or Italy or whatnot. We fill out this paperwork daily, we sanitize, then we go to the rehab department. Now, in the rehab department, we have to wear our mask, shield, gown, gloves. I actually wear like a hair bonnet, a hair net, and we treat our patients. Now we have different levels. It's a two-level building, and we have a dementia unit. We also have our long-term care, and then we have our subacute unit. Now the floor where the rehab gym is also in the subacute unit. And that particular unit is still allowed to come to the rehab gym, whereas the other units are on their own separate shutdowns. So we have to go to those people. Um, just like everyone else, we're using universal precautions. Where after each patient uses an item, we're sanitizing. We're constantly washing our hands. Um, the other thing that we're doing too is when we get ready to leave, we have to also take our temperature before we leave the building. My building is no longer accepting patients, so I would say I can't really pinpoint exactly when we decided to stop accepting admissions, but we did stop accepting admissions. Um, so because of that, we have a very small caseload to the point where a lot of our therapists are working at different buildings um, permanently for the moment because of COVID. I'm still at my building, however, my hours are quite short. But the thing that concerns me is the level of cases that is circulating, and I don't think people really truly understand the magnitude of how many of these seniors is catching this virus and actually passing from it. So I just want to bring light on the struggle and what's happening. What you've heard in the media of not enough personal protective equipment, it's true. There's not enough. Um, Me personally, I was blessed to have a husband that was able to get me a 95 mask. However, not everybody is that fortunate, and we find ourselves having to use our mask for 1, 2, even 3 weeks. Um, I've been through masks that have broken on me, and I had to get another one. Some people are coming in with cloth masks, whatever they can find. The facility is, in my opinion, is trying their best to provide us with what we need, but it's still difficult, especially with gowns. Gowns are extremely, I would say gowns is the most limited thing right now, to the point where if you're treating a patient that has, let's say, droplet precautions, or they also have the virus, and you might have three patients on that same floor, then you're actually going from that room to the other room to the other room, because these three individuals are on the same floor and they both have the virus. They all three have the virus. So you're still wearing that gown, because as we were all trained and taught, you put on your gown outside of the room, you enter the room, you treat the patient, and you remove the gown before you actually leave the room and go see another patient. But because resources are so limited and so low, that is the way we have to do it. And it's very unfortunate, it's very uncomfortable, and it's truly sad being the country that we live in. um, Gloves have not been a problem. There's plenty of gloves, I have to say that, but definitely masks and gowns are still a problem. We do have face shields, and they honestly, they look like homemade face shields, but they work. That's all I can say about that. So I'm just curious to know what's going on with you guys. How is life right now in the occupational therapy world with COVID? I know there's some therapists, especially OTRs, are able to do um, tele teletherapy, where especially for pediatrics. But what's happening in these skilled nursing facilities? What's happening with the therapists that can't work remotely? How are you guys maintaining? What are you doing? How's it going? I know for us, we try not to treat patients with the virus. However, it's looking like we're going to be treating them on a consistent basis, how things is going. So let me know, are you treating COVID patients? Are you not treating COVID patients? How is your facilities handle it? And again, you don't have to say the names of where you're at. I would just say your location, if it's New York, if it's Pennsylvania. I would love to know. All right. So I hope everybody stays safe, and just do your best, guys. All right.